Okay, hello. My name is Associate Prof. Dr. Mohd Shahrir. I'm a rheumatologist from HUKM. Before I start this hand examination video, I would like to thank the Vice Chancellor of UKM, Prof. Dr. for allowing me to take the video. Second is my Dean, Prof. Datuk Dr. Raymond Azman Ali, and my Head of Department, Prof. Datin Dr. Nurlina Ibrahim, for allowing me to do this video. So, on hand examination, it is actually most of the time reserved for rheumatologists and orthopedic hand surgeons, and therefore is quite a specialized examination for both our teams when we talk about hand examination. However, in rheumatology, hand examination is a way to diagnose the disease that the patient has, either rheumatoid arthritis, either psoriatic arthritis, either gout, either systemic lupus erythematosus, by doing a complete and adequate hand examination. So we are examining a normal hand, but mind you, the steps are still the same if you talk about rheumatoid arthritis and psoriatic arthritis, but it may be different in scleroderma and chronic tophaceous gout or your SLE. So although hand examination is something that we should be well aware of and comfortable in doing it, but in the exams, both undergraduates and postgraduates, is a different emphasis. For undergraduate, somehow the examination may be a bit detailed because it is only localized, but for postgraduate, it is part of a systemic examination, most likely combined with respiratory or most likely combined with general features in the exams. So a hand examination of RA, there's only a few deformities that is needed to be understood and recognized, which is your Boutonniere deformity, your swan neck deformity, Z deformity, and ulnar deviations of at the MCP or at the wrist. So we always start by inspection. Inspection includes recognition of the deformity just now and recognition whether the joint is active or not. Active joints will mean that it is swollen, and the overlying skin is most of the time erythematous, but sometimes it is not erythematous. So we have to detect also by temperature. We test the temperature on both sides. We are not comparing. We want the number of joint swellings. So we test using the forearm as a standard point of the temperature. Next, we have to observe the nails for pitting nails, which is suggestive of psoriatic arthritis. And then we describe the swelling, as I mentioned. We describe the deformity as a repetition to what we're supposed to say. We also have to recognize the guttering over the areas between the MCP and the wrist to suggest muscle atrophy. Then we go for your joint tenderness. So we start off either using the little finger or the thumb, depends, but I prefer to use the little finger and then move in from the patient's left to the patient's right. So we test starting from DIP, PIP, MCP, and at the wrist. This is if we talk about hand examination. We do it until our thumb color changes to white. That's how hard we test for the tenderness. Noticing the patient's grimacing and also asking the patient whether there's any pain. Any pain, no? It's mandatory in hand examination that you explain what you do to the patient. Okay, so she has none of those. Then another step is to recognize whether the deformity is reversible or irreversible by doing this position. Because if the joint pains, the joint deformity is reversible, then it is can be splintered. If it's irreversible, then there's no use to do anything for the joints anymore. Deformity is irreversible. So as long as they can do oppose both fingers together like this, then the deformity is not present, or it is irreversible. It's reversible. Sorry. Okay. So in this position, we are supposed to observe for hypothenar and thenar eminence atrophy, and also any vasculitis lesions around the tips of the fingers and around the palm area. And if it's a new one, it is supposed to be red, reddish and tender. If it's very old, then you have hyperpigmented spots, irregular spots all over the palm area. Okay. Then we screen for the nerve palsies, ulnar, radial and medial. So we demonstrate to the patient, okay, do this. That's for the median, that's for the ulnar nerve. And then we extend the last 3 fingers for the radial nerve, open the circle, and then extends the wrist for radial nerve. So it means that all the nerves are normal. Now, if there are any abnormality by the screening, for instance, there's an ulnar problem, an ulnar nerve, then you have to recognize the clawing of the fingers, and also a specific sign called the Froment sign. The Froment sign is done by doing this, putting the paper like that, and then pulling. If the patient can still resist, that means there is no sudden straightening of the thumb, then it is normal. If it's not, then you are suspecting an ulnar nerve palsy. This is Froment sign. Okay. The rest, like the patient will unable to extend the wrist, that is radial, and your inability to do pincer grip, which is testing your opponents, which is actually your inhibited by your median nerve. Okay, right. Then we go for specific muscle function and areas. Okay. Firstly, the thumb. This one you have to compare right and left. Then opponents. Okay, don't allow me to break the circle. By right, all the other fingers as well, but this is the most important one. So supposedly due to time constraint, you just skip the middle ring and little finger opponents, and then the intro sign, and up. Okay. Then we test for sensation. Firstly, asking the patient what does the patient feel, not whether the patient can feel or not. How do you feel? Sharp. Okay. So close your eyes. If you feel sharp, then just say yes. Then we go, that is for C6, C7 and C8. Then we go for Tinel sign. Tinel sign is between the eminences, just 1 centimeter distal to the wrist, the crease of the wrist. So I will tap. Ada rasa any electric shock? Yeah? Okay. Provided that the wrists are normal, then you ask the patient to do the phalanx sign. This is to be maintained for at least a minute. Okay. And finally is functional. Functional grip strength. Okay. And then turning the key, buttoning and unbuttoning the shirt buttons, and combing the hair. So this completes hand examination in under 10 minutes of examination. So this video is It's an educational video. It's not meant for any. It's not copyrighted, and furthermore, it is not for monetary gains. Thank you.